There is no routine scheduled maintenance for a breast implant. In other words, there's no time, whether it's 5, 10, 15, or even 20 years, that we say you have to replace the implant. Some surgeons arbitrarily pick a time, 10 years or 20 years, but none of that is really grounded in science. Fortunately, at some point, usually there's something that a patient wants to change, like they want to be bigger, they want to be smaller, they want them out, they've gotten droopy. There's often something that's going on that really can drive the operation and justify it in the patient's mind, rather than an arbitrary number of years. So the way I look at this is when a patient comes in and asks about the age of their implant and whether they need to do something, I try to get them to focus on whether there's something that's bothering them. And then we make that the reason for surgery. But age alone, it's really hard to use that as a justification for surgery if you're otherwise completely happy with your implants. Now, we get into the issue of, well, at a certain time, should we get an MRI to see whether there's a rupture of the implant? Now, before doing that, we have to understand that MRIs aren't perfect. It's possible there's a rupture they won't pick up, and it's possible the MRI will say that there's a rupture when there isn't, and then you'd have your surgery and found out that you really didn't need it because you didn't have a rupture. Now, for new silicone implants, the FDA has suggested getting an MRI at 3 years and then getting an MRI every other year thereafter to see if the implant is ruptured. It's up to each patient to decide if that's something that they want to do, and it's something I can discuss with you in length, particular to your specific case, to determine if that's something that's right for you. But within the context, where were we a minute ago? We were just talking about, well, what about the age of an implant? I think that one of the issues with the age of an implant that always has to be brought up, if a certain number of years have gone by, we should talk about whether an MRI should be done to check to see whether that implant is ruptured, even if you're otherwise happy with the implant.